Welcome back to the Aberdeen Audiology YouTube channel. I'm Dr. Tom Goyne, and for this video, I'm joined by Dr. Kristen Sabatino, who is one of our audiologists with Aberdeen Audiology. We have offices in Wayne and Westchester, Pennsylvania, the Philadelphia suburbs. So if you have any sort of issues or difficulties with your hearing, your balance, tinnitus, you're curious about cochlear implants, hearing aids, any of those things, we'd love to hear from you. Speaking of balance, we're going to be talking today about the most frequently asked questions we get when it comes to people's balance. So we get a lot of questions about this in the course of our days. And so Kristen, Dr. Sabatino, is one of the folks in our practice who does a lot of the balance evaluations and works with those folks a lot. So I thought it would be great to have her join me for this video, and let's get to it. Are you ready, Dr. Sabatino?
Yeah, thanks for having me.
Yep. So, well, it's a tough invite to get, but so first question. First question we get a lot is, well, why would I get a balance evaluation?
That's a great first question. So we'll start with the most obvious concern, and that's the spinning or dizziness or unsteadiness on your feet. If you have symptoms of dizziness, or when you're walking, you feel like you're unsteady, or if when you're sedentary and you feel like you are spinning or in motion, or even if you are in walking and you feel like the world is moving around you, people will sometimes describe that as vertigo. And the classic medical definition for vertigo is a hallucination of external motion or the world moving around you. And when you have those symptoms, we need to assess why that's happening. And a good chunk of that does fall under the inner ear and the balance system.
Right, right. Yeah, the way I sort of think of it is, our testing can help figure out, is this, is the reason you're unsteady, is that in part because of your ear? Is it in part because of your eyes? Is it in part because of your proprioception, your feeling and sense of your limbs in space? Or is it, how the brain integrates all of that? And so our testing, I think, does a really good job of figuring out, okay, of those things, is it one of those? Is it a couple of those? And so without the testing, it's all just sort of guesswork. Would you agree?
Exactly. I mean, it's really interesting that when we start to have issues with balance, we can recognize that you're right. It is either your ears, your vision, or your proprioception. And all three of those really work in tandem. And so when one of them is not working as well, we can see one of the other two suffer, or
Right,
even all three.
right. And so another question we hear a lot is, well, I've had some dizziness in the past, and I've seen a physical therapist about it, and it helped a little bit. So if I've already had vestibular therapy or physical therapy for my dizziness, why would I get a balance evaluation?
I get that a lot. And I tend to ask more questions when that happens or when I hear that response. I will usually ask them, well, what did you go see them for? What were your symptoms? Are you feeling any better? Or do you still feel like you are symptomatic? What I hear a lot often is that, well, I have a patient say, "Oh, well, I went to them because I had a hip problem, or I went to them because I had a back problem." And then they also said, "Oh, well, we'll just work on your balance as well." And that's great. I mean, we want everybody to be better on their feet. We want them to reduce their falls risk. And there's a lot of physical therapists out there who can work on your balance. However, there's an even more finite subset of physical therapists out there who have a very special certification or special coursework and studies in vestibular rehabilitation. And so it's important to know that we want to get you to those right people, and they really value the information that we get from a thorough balance evaluation. And they use that as their roadmap to success in creating a better plan of care and a better success rate with their patients. And the other reason why you would want to have a thorough balance evaluation, even if you did have a balanced therapy, is there's other symptoms that can arise when you have imbalance. And those symptoms of imbalance can also be a sign of a greater issue. And so, for example, with migraine sufferers, 25% of migraine sufferers complain of vertigo, and 66% of them complain of motion intolerance. When we do a thorough balance assessment that includes an intake in their history, as well as some functional assessments, we can glean from that symptom presentation as well as our test information if there's other symptoms related to your balance that are involved. And with migraines, we want to make sure that we get you to the right specialist. Sometimes a physical therapist alone might not just do the trick for you. You might need to see a specialist like a neurologist.
Right. Yeah, I think that's fantastic. That's one of the reasons why, I wanted to embark upon this balance program, these balance services in our practice, was to help physical therapists, help neurologists, help ENTs, help our patients figure out, okay, there could be a number of reasons why I'm dizzy. Let's see if we can pinpoint it rather than, just sort of throwing some stuff against the wall, as they say. And, back to the physical therapist, I think we've done a pretty good job of identifying a couple in the area that really enjoy the balance work. It's what they, when they're driving to work in the morning, I get the impression that's what they're looking forward to, and that's what they think a lot about. And so then therefore, no surprise, they do a really good job of taking the information we give them and applying it. Like you said, it's a roadmap to get the patient where they need to go. So those are two very common questions we get. This next one could be the most common question we get, certainly in the top three, and that's one of the reasons why we're including it. And so the question is usually something along the lines of, I've heard there's crystals in the ear that can get out of whack. Is that why I'm dizzy? What's the deal with these crystals, Doc? Is a question we get from time to time. So what's going on with the crystals? Tell us about the crystals.
I get this question a lot. So here's the unique thing. Everybody has these crystals. It's when they are displaced or when they move from where they are supposed to be that causes problems for people. And these problems are very often a very rapid, intense sensation of motion or dizziness. It often induces panic, nausea, vomiting, really intense spinning. And patients often are very concerned about what's going on. Those crystals can be moved. And so the good news is we can assess that. An audiologist can assess that through our thorough test battery, and we can determine where the crystals are, what's triggering those symptoms. And the even better news is we can treat it in the office. We can be very successful in treating it in the office. And the research indicates that if we do a good job of treating it, it can also often be resolved in 1 to 2 treatment maneuvers.
Yeah, it's really impressive to me. It still amazes me to this day, and I've been doing these maneuvers for probably 10 or 15 years now at this point. It's still amazing to me that just these maneuvers can kind of alleviate such intense symptoms. Another question we get sometimes is along the lines of the crystals, is well, I was just given some exercises to do myself. And so what are your thoughts in terms of somebody doing it on their own versus doing it with doing the maneuvers either with us or with a physical therapist?
The exercises are nice to have. I think that if you want a more targeted treatment or you want to have a more effective treatment, have the professionals do it. I've come across cases of individuals where they said, "Oh, I Googled these exercises and I started doing them." And coincidentally, they did it the wrong way and it made it worse. And they
Right.
made their symptoms a little bit more complicated and required even more treatment maneuvers from the professional. Or they've gotten somebody gave them the exercises and it just took longer for them to recover. I mean, the goal of doing these repositioning maneuvers that we do in the office is that we want to do it as effectively as possible and get you back to the things that you like to do, get you
Right.
back to your daily activities without having a fear of falling or fear of being sick, fear of spinning. We can alleviate that for people quickly.
Yeah, that's a good point. The analogy I use a lot is some people may remember, this is getting to be kind of an old toy now. I don't know if they make them anymore. It doesn't have a screen, so but if anyone remembers, there was like this. It was sort of a box with a maze on top, in a little hole and a marble, and you had knobs on
Yeah.
the sides, and you would move the knobs, and which would in turn move the maze on top, and you were trying to get the marble back, into the hole, into its home. And so I sort of use that analogy with the crystals in the inner ear. They've gotten into a chamber of the ear that they shouldn't be in. We're trying to get them back to the chamber they should be in and they're supposed to be in. And if it's done the right way, it's pretty efficient. If you know how the maze works, you can get them back there relatively efficiently, and it works really well. So one final question for now. Another question we get a lot, or a topic that comes up, is a lot of folks attribute their dizziness to blood pressure issues, which is entirely possible. But sometimes I feel like people attribute their dizziness to blood pressure a little bit too often. They say, well, when I stand up quickly, I get dizzy. Well, it could be blood pressure. It could also be crystals that have gotten out of place. And it could be a whole bunch of other things too. So if you wouldn't mind, just sort of explain a little bit how blood pressure affects our balance, and how we as audiologists would help people tease out whether it's blood pressure, whether it's something else, or whether it's a combination of a few things.
Okay. So with blood pressure, we get a lot of complaints or a lot of reports from people saying, well, if I stand up too quickly, I get a little lightheaded. What I like to do with people is really try to tease that out a little bit more through our questioning that we use in our case history. I'll ask them, how long does it last? Is it brief? Do you feel like you're spinning? Or do you see this in any other area? Is it when you're bending over? Um, Most patients' primary care physicians can really rule out orthostatic hypotension, which is lightheadedness or dizziness associated with blood pressure, by doing a couple simple tests in their office. So we really try to, from our angle as an audiologist, rule out the non-blood pressure related symptoms. So looking at those, is it the crystals? Is it that BPPV or those crystals that we were talking about? Or is it something else that's going on? Is it dehydration? Is it blood sugar related issues? So there's a number of questions that we can ask with when it comes to blood pressure that might not necessarily be related to blood pressure. And then our testing can help rule that out.
Yep. So this is a great start. This is a lot of the questions we get, and I think this will hopefully illustrate to a lot of folks how we as audiologists can contribute to their balance issues, and how we can maybe get people from point A to point B a whole lot quicker and a whole lot more efficiently through the use of some of the testing equipment that we have, and our ability to decipher things in people's case history and combine that with the test data, and again, get them to point B much quicker and much easier and much more efficiently, rather than seeing professional after professional and making some headway but not a lot of headway. So this is a great start. I'm sure we'll do more of these and explore more topics with balance. Thanks for joining me, Dr. Sabatino. Again, these invites are hard to get, so
Yeah, my pleasure.
right. Okay, thank you again. We're Aberdeen Audiology, offices in Wayne and Westchester, Pennsylvania, Philadelphia suburbs. If you need any help with your hearing, your balance, any of those types of things, look us up. We'd like to help.